Welcome everyone to our Friday morning news briefing. I'm Sunita Sarabji, Ethnic Media Services Health Editor and your moderator for this briefing, for which we partnered with the Blue Shield of California Foundation. Today's briefing focuses on domestic violence as one of the major factors contributing to homelessness. A new study released last month by the University of California, San Francisco, Benioff Homeless and Housing Initiative finds that at least 17% of homeless people fled their homes because of intimate partner violence. Speakers this week will discuss how domestic violence often leads to homelessness, the barriers to getting housed again, the findings of the UCSF study, and the increase in domestic violence over the past 3 years. We will also hear directly from a formerly unhoused survivor of domestic violence. Our speakers today are Dr. Anita Hargrave, assistant professor at UCSF and the lead researcher on the BHHI report Towards Safety, Understanding Intimate Partner Violence and Homelessness. Jennifer White-Reed, the Chief of Staff and Senior Advisor to the CEO at the Urban Resource Institute. URI NYC is a nonprofit organization which provides services to victims of domestic violence and unhoused people. Finally, Desiree Des Martinez, the Executive Director of We Are Not Invisible. Ms. Martinez experienced homelessness for 5 years due to intimate partner violence. We ask speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean. And we ask reporters to answer questions in the chat. We will send a video of today's briefing and expanded bios with contact information for each speaker to all participants later on today. Our speakers are also encouraged to answer questions in the chat throughout the conference. So now we begin today with Dr. Anita Hargrave. Dr. Hargrave, welcome.
Thank you, Sunita, and thank you all for having us here today. It's such an honor to be able to be here and to share a little bit of our work with you. I'm going to just show 4 slides and talk through some of our recommendations and our policy points.
Are you able to show your slides, Dr. Hargrave? Oh, there you go.
It is, but let me make sure that the it's actually showing not my presenter slides. Is it showing the presenter slides or the which view are you able to see?
It's just your view.
Okay.
No, it was better, but yeah, it was correct before. It was just the view. It didn't have any of the notes or anything.
What's interesting about this Zoom meeting is that when I share my screen, it doesn't let me it does not let me share my full presenter slide. It only allows me to share the I'll try it one other way, but it doesn't let me share my screen how I've usually done it, which is interesting. Always new challenges.
Right.
This is it looks like it only allows me to share the presenter, my presenter notes, not the actual slides. So what I can do is just minimize this for you so you can look at the slides themselves. Can you see is this big enough for you all?
That's perfect. That's perfect.
All right. 1 second. Let me just thank you for bearing with me as I get this all in line. Okay. Well, thank you again for being here with me. Last month, the Benioff Homelessness and Housing Initiative released a report about the intersection of intimate partner violence and homelessness. The analysis is based on survey data and in-depth interviews from the California statewide study of people experiencing homelessness, or CASPA, which is the largest representative study of homelessness in the United States since the mid-1990s. CASPA was conducted at the request of the California Health and Human Services Agency to answer critical questions about homelessness facing California policymakers. The main report was released in June of 2023. CASPA was conducted in 8 counties, representing 8 regions. It included adults over the age of 18 experiencing homelessness, and it resulted in 3,200 questionnaires paired with 365 in-depth interviews. 50 of these interviews focused specifically on intimate partner violence, or IPV. However, in our qualitative analysis, we included all interviews in which participants talked to us about experiencing IPV, and this ultimately led to the inclusion of 104 interviews. Importantly, this work involved community-engaged practices, including 3 community advisory boards. Des Martinez, who is here with us today, was on the Lived Expertise Advisory Board and will speak after me. As I said, last month, we issued a special report based on our findings from the CASPA study called Towards Safety, Understanding Intimate Partner Violence and Homelessness. And it analyzes the impact of intimate partner violence on experiences of homelessness. Intimate partner violence, or IPV, is also commonly referred to as domestic violence, or DV, and it encompasses violence, abuse, or aggression committed by a former or current intimate partner, such as a spouse or dating partner. I'm going to go over just a couple of our key findings. 40% of participants who reported intimate partner violence in the 6 months leading up to homelessness indicated that violence was a reason for leaving their last housing, and 20% indicated that it was the primary reason. Survivors had extremely low incomes prior to homelessness and reported that their monthly household income was $600 less than the median rent for a 1-bedroom in the state. This shows that intimate partner violence can precipitate homelessness for many people and is particularly dangerous for those that are at the economic margins. Another key takeaway is that many participants reported that relatively modest amounts of financial support could have helped them to avoid homelessness. Many survivors who reported IPV prior to homelessness, among survivors who reported IPV prior to homelessness, 73% believed that a shallow monthly subsidy would have helped them to avoid homelessness for at least 2 years. 83% believed that a lump sum payment would have done so, and 92% believed that a housing voucher, similar to a housing choice voucher, which would limit their rental contribution, would have kept them housed for at least 2 years. Participants reported leaving their homes as a survival strategy, even when they had rental subsidies. This indicates that the need to ensure safety superseded usual protections against homelessness. Many participants, 42%, who experienced intimate partner violence prior to homelessness, experienced it during homelessness as well, and felt that being homeless left them vulnerable to increased violence from their intimate partner. Finally, 95% of all survivors reported that the high cost of housing was a barrier to their exiting homelessness. 61% reported that poor credit or eviction history, which were often a consequence of intimate partner violence, were barriers to regaining housing. Despite these challenges, survivors impacted by intimate partner violence described pathways forward to housing stability and healing. However, they reported that obtaining that stability and recovery would require increased access to non-congregate, trauma-informed domestic violence shelters, flexible financial support, specialized services for intimate partner violence, and support for finding permanent housing. Based on the report findings, BHHI endorses policy recommendations at 4 key areas. The first is that there's a critical need to increase access to affordable permanent housing for survivors of intimate partner violence, to allow for swift exits from abusive situations, provide safety and security needed to thrive and heal after experiencing violence, prevent resultant homelessness, and to decompress domestic violence shelters so that they have the capacity to serve other survivors in moments of crisis. In California, we are 1 million units short of available and affordable housing for extremely low-income individuals. One mechanism for making current housing more affordable is housing subsidies. In CASPA, 92% of survivors experiencing intimate partner violence leading up to homelessness told us that a housing voucher would have helped them to prevent that homelessness. Yet, currently, only 1 in 4 people who are eligible for federal rental assistance receive it. In places like California, where the cost of living is high, survivors are stuck between a rock and a hard place, with limited alternative housing options that would allow them to escape abuse while avoiding homelessness. As a result, many survivors are forced to make the impossible decision to remain in an abusive relationship or escape and face the risk of homelessness due to lack of available housing. We need to bolster homelessness and violence prevention. This includes creating flexible funding programs and specialized coordinated entry systems for those fleeing intimate partner violence. We need to increase support for survivors currently experiencing homelessness, as this places them at increased risk of continued violence and underscores the need to expand domestic violence shelters with dedicated permanent housing options. And finally, we need to center equity in all responses, programs, and policy efforts to address intimate partner violence. I hope that people will leave today knowing that we must address the relationship between intimate partner violence or domestic violence and homelessness. Intimate partner violence can precipitate homelessness and can often worsen when someone is unhoused. To address these complex issues and prevent them from happening in the first place, we need to support survivors' basic economic needs by offering flexible funding assistance and permanent affordable housing. All right, with that, I thank you, and I'm happy to answer any questions.
Dr. Hargrave, thank you so much for your initial comments. We do have a number of questions in the chat for you, some of them which were just sent to me. We'll start with Henrietta Burrows. Henrietta, please ask your question.
Thanks, Sunita. Were any of the survivors, did any of them indicate that they had contacted shelters for battered women and had received assistance? I didn't hear any mention of these shelters in your presentation. So are they part of the solution to the homelessness, providing homeless homes for battered women?
Such an
or
important
battered partners.
Yeah, thank you for that point. And I wish we could have shared all of our data all of our information today, and we had limited time, but we did look at that. We looked at how many people who are experiencing intimate partner violence in the 6 months leading up to homelessness were staying in domestic violence shelters, or in the general shelter system, or were experiencing unsheltered homelessness, which means living in a place like on the street, in a car, or in an abandoned center in a park. And we found that many people wanted to get into domestic violence shelters, but faced real barriers in being able to enter them. And this really comes down to and that shelters didn't have the capacity to meet the need from survivors needing shelter. About 5% of the survivors reported that they spent most of their nights in a domestic violence shelter. The majority of survivors reported that they had spent most of their nights unsheltered. And so I think that this shows that there is a real need for expansion of DV shelter services for survivors in moments of crisis. And that these shelters really can provide needed services for accessing housing, for accessing mental health services, and that they're also coming up against constraints, resource constraints that they have within their facilities and within their funding mechanisms. So your question was whether DV shelters and DV programs are part of the solution. And I would say that they are, and they're also extremely limited in their ability to face this incredible problem. And that we need to be able to advocate for them to obtain greater resources, greater funding, and greater training around trauma-informed approaches to working with people who have endured violence and trauma.
Thank you. We have a question. Was there a racial or ethnic breakdown of the respondents?
There was. I don't have that off the top of my head, but I can put it down in the chat. I don't know, Sunita, were you able to put the report into the
I
chat?
did, yes. Yeah.
We have in the report the ethnic and racial breakdown of how people self-identified. And I think an important aspect of all work on homelessness and domestic violence is that we see that it disproportionately impacts communities of color, Black and African American, Black and African American populations, Native and First Nation people. We see that there are incredible disparities in both the experience of homelessness and in exiting homelessness.
And Dr. Hargrave, you spoke about, needing perhaps vouchers, rental subsidies, or a lump sum amount. In California, what does that look like, given the high cost of housing, as you mentioned?
There are various programs in each state. You're right, there are differences state by state, even within counties, in the way that resources are allocated. And what I can say, our study didn't specifically look at which types of resources people were able to obtain and how, but there are programs called housing first, or sorry, there are housing vouchers that work like subsidies. So they will help to pay up to 30% of the rental of your income. And so the idea is to pay for a portion of the rent to allow you to, with your current income, to sustain a long-term housing unit.
Absolutely. And just a quick follow-up question from me, how do survivors access these kinds of programs that they may be eligible for? And do you see that many people who would be eligible for such programs just don't know how to go about accessing them?
I think that Des might have more experience on, like, firsthand experience on this. So I will say that there are different ways that people can access the voucher system. We didn't study that particularly in BHHI, so I can't speak to all of the details on that. But what we do know is that people were telling us that it was extremely hard to get access to the housing vouchers. In our qualitative data, people also talked about being worried that they would lose a voucher if they were to leave a relationship, that they were forced to leave a housing situation where they even had a housing voucher because of the escalating violence and threats to their physical well-being. And so I would say that what we did see is that some survivors, even with housing vouchers, struggled to maintain housing because of the violence that they were enduring in the home. And so we need to be able to support this very high-risk population that in allowing them to regain housing vouchers if they had one previously, and for those that weren't able to get housing vouchers, to expand their access in the first place.
Dr. Hargrave, thank you so much for joining us. We will come back to you for a final round of questions. We now shift our focus to New York, which has experienced a dramatic uptick in domestic violence over the past 3 years and a resulting increase in the number of unhoused people. We welcome Jennifer White Reed from the Urban Resource Institute of New York City. Jennifer, welcome.
Thank you, Sunita, for that warm welcome and for the opportunity to talk about an incredibly important topic and share strategies to reduce domestic violence and homelessness. My name is Jennifer White Reed, and I serve as the Chief of Staff and Senior Advisor to the CEO at Urban Resource Institute, URI, a nonprofit organization in New York. URI is the largest provider of temporary housing for survivors of domestic violence in the country and is a leading provider of transitional housing for families experiencing homelessness. URI is committed to ending cycles of violence and homelessness by offering trauma-informed, client-centered support to the families that we serve. We operate 23 shelters in New York City, including 15 shelters specifically for domestic violence survivors. Every night in our residential programs, we provide temporary housing to over 3,000 people. And annually, we provide trauma-informed programming to approximately 40,000 people facing domestic violence and homelessness. Beyond providing transitional housing, URI empowers families to attain economic stability. We work with youth and communities to disrupt cycles of violence, and we are committed to involving those who have caused harm in developing solutions to end such violence. In addition to services, we are committed to amplifying survivors' voices and creating change through advocacy and community engagement. Domestic violence is certainly a leading cause of homelessness in New York and across the country, with many individuals and families forced into homelessness while fleeing abuse. Approximately 40% of women and children in New York City's homeless family shelter system are there because of domestic violence. And a recent data from the New York City Domestic Violence Fatality Review Committee underscores the urgency of our mission. Between 2021 and 2022, intimate partner homicides increased by 29% citywide. The increases were even more pronounced on a borough level, with Brooklyn experiencing a 225% increase in intimate partner homicides, and the Bronx experiencing a 57% increase over the same period. Despite New York City making progress in reducing other forms of homicides, domestic violence homicides persist. And based on the data, this surge in intimate partner homicides continues to disproportionately impact Black and Hispanic women from marginalized communities. Homelessness and domestic violence are linked. Preventing domestic violence will prevent homelessness, and housing and economic stability increases safety. We can reduce domestic violence and homelessness by investing in community-led solutions that center equity and the voices of survivors. URI is working at the intersection of homelessness and domestic violence to provide support to families and communities, and we are engaged in prevention and intervention efforts and advocacy work on an individual and system level. Last month, URI released its Blueprint for Change policy document, which I believe will be dropped in the chat soon, that outlines various solutions that New York City and other government agencies can utilize to address domestic violence effectively and consequently reduce homelessness. These solutions are focused on 3 core areas. 1, prevention, investing in education and awareness. 2, economic stability, expanding economic opportunities, and 3, housing stability, improving access to shelter and affordable permanent housing. So in terms of the prevention, investing in youth violence prevention and healthy relationship education, particularly in high-risk communities, can help interrupt the cycles that fuel domestic violence. URI's relationship abuse prevention programs play crucial roles in prevention and intervention efforts in New York, educating youth in middle schools and high schools, and intervening early to break the cycle of abuse. Meanwhile, trauma-informed accountability programs for individuals who have caused harm, like URI's Abusive Partner Intervention Program, are important to our communities as well. Understanding the roots of harmful behavior and working with individuals to develop behavior changes is key to addressing the issue effectively. Many people who have caused harm have experienced violence themselves. Without excusing violent behavior, it is vital that we understand the impact that trauma has had and provide tools to stop the violence while requiring accountability. And in terms of economic stability, in the journey from surviving to healing, URI's clients encounter numerous barriers that make it challenging to leave abusive situations. Domestic violence manifests in various forms and includes economic abuse, which is experienced by 98% of survivors and often serves as a primary reason survivors stay or return to an abusive partner. In February of last year, URI played a crucial role in advocating for the passage of a New York bill, which redefines victim of domestic violence under the New York City human rights law to include economic abuse, which includes coerced debt. This means that survivors who have experienced economic abuse will have extended protections under the law. Economic abuse, which includes coerced debt, involves tactics of power and control to hinder an individual's financial independence. Survivors may, for example, be coerced into incurring debt through threats or manipulation by an abuser. URI's Economic Empowerment Program offers workforce development, employment assistance, and access to affordable housing resources, all designed to support survivors and their families as they work to achieve economic stability. And in terms of housing stability, URI works to remove barriers to housing stability and offers safety and services to people and their beloved family pets through our groundbreaking trauma-informed People and Animals Living Safely, or PALS program. Learning that 50% of survivors would not leave a dangerous situation if they could not take their pets with them, and understanding that pets are family and support the healing process, we launched PALS 10 years ago. PALS is the first and still the only dedicated program in New York City and a few nationally to allow domestic violence survivors to live and heal together with their pets in shelter. We've learned certainly that by listening to survivors and investing in education, responsive programming, and the right resources, we can save lives. With alarming increases in domestic violence homicides, targeted interventions and support services are desperately needed. We cannot do this work alone. We need the help of the community and media to amplify survivors' voices and raise awareness about organizations like URI in New York. By shining a spotlight on these issues, we can build a more supportive and empathetic community that stands united against both domestic violence and homelessness. I want to thank you for your attention, and I'm happy to answer any questions that you may have. But first, I am honored to share a short clip of Hope Dawson-Sessions, who is a survivor and former URI client, as she appeared on ABC's Here and Now. Hope found refuge at URI alongside her children and beloved dog Coco. Drawing from her own experiences of displacement and trauma, Hope employs a trauma-informed approach to storytelling, aiming to inspire others to navigate through adversity towards hope and resilience. She has authored multiple poetry books and is publishing a memoir. She also has a YouTube channel. I just want to say, through her work, she empowers her audience to embrace their own paths, fostering a message of perseverance, healing, and triumph over life's challenges. You can run the video. Thank you.
Jessica, could you please run the video?
You into the conversation because I understand that you're kind of an ex-client of URI's. Talk to me a little bit about what happened that made you seek the services.
Yes. So I am a former resident of URI, and I think, just not to backtrack, but one of the reasons why I believe that we're seeing a uptick, and there will probably continue to be one, is because a lot of times when we talk about domestic violence, we talk about the hospital bed. We talk about when it's very extreme. And so a lot of times people don't even recognize that they're in a violent situation until it's at that point where your life is, threatened, but not realizing that raising your voice, controlling behavior, controlling the finances. There are so many different red flags, if you would, that if we start to destigmatize the conversation around domestic violence and what that looks like, and we actually address all of the unhealthy interactions we have, then we can see more people get help sooner.
Thank you, Jennifer. We have a number of questions for you. I will ask the first question, which comes from Mira Kaimal of India Currents. Given privacy and safety concerns for survivors, do you know if there's any regulation to inspect and oversee shelters? And Mira says, a survivor we interviewed sought refuge in a shelter, and she left because a person at the shelter tried to traffic her and threatened violence if she did not cooperate. She alleges that shelter staff did not intervene after her complaint.
Thank you for that question. I'll start with the first question around privacy. And that's incredibly important to raise. Our survivors who flee and come to our locations are coming with the expectation that their information, their name, details, all of that will be protected at the highest levels. We do in New York have licenses to operate our shelters. And we want to ensure the state wants to ensure that there's consistency in practices, right? So we are all required to comply with a host of laws and codes to ensure that we're offering quality services in a safe environment. And so there are inspections that happen. Regulatory entities in New York State do inspect, they visit the location, but they comply with the federal law that ensures that the details, the name, social security number, those types of confidential details are protected. And in terms of the second comment, I think about how shelters are operated across New York City and across New York State and the country. And there are various ways in which to be leaders in the space. I can only speak to Urban Resource Institute, and we have really thought about the importance of the survivors' voices. And many of our policies and procedures have been developed after having conversations with the impact of our policies on individuality and healing. And I think our People and Animals Living Safely program is a good example of how you need to really look at the community and figure out what are the needs. And then once you identify the needs, to embrace survivors' voices, to hear how to implement services in a way that is trauma-informed and appropriate. And so we look at building custom-built locations. In the last 12 years, we have grown our capacity from 4 shelters to now 15 specific domestic violence shelters. And we really look as a leader in the community to having standards that even our colleagues can meet. And so we offer technical assistance and training to other providers to ensure that we are offering the best quality services as a community.
Thank you. One more question, and then we'll go to Henrietta, who also has a question. This question came in from a reporter. Did the pandemic exacerbate already violent homes? You showed data over the past 3 years when so many of us were in lockdowns. Do you believe that that was an indicator, for lack of a better word, to the violence that we saw during that period of time?
Great question. Absolutely. During the pandemic, we saw spikes in calls for assistance. We heard stories of survivors who now had to remain in an environment because their abusive partner maybe was working remotely and what didn't leave. So they had to think about creative ways to text and to maybe visit the grocery store to communicate that they needed to leave and then go into shelter. I think it was also an intense period of time with stress and lack of access to resources and information. So certainly the COVID-19 pandemic created a reason for an intensity of domestic violence in homes. And it also calls for a need for increased capacity and services so that when we are in crisis, that there are staff and programs that can meet the need, especially for those who are suffering from trauma and other mental health concerns. And COVID certainly made it even more challenging to be free and to be safe and to really live a life that was healthy and allowed clients to strive.
Thank you. Our final question comes from Henrietta Burrows. Henrietta?
Thanks, Sunita. Jennifer, when we see photos in the news of homelessness in urban areas, we see people strung out with severe cases of drug addiction, and we see them in their tents and inebriated on the streets. We don't get photos, or we don't get the vision that these are people who, or we don't get images of women and children seeking help because of domestic violence. There seems to be a disconnect somehow. So what percentage perhaps are the people that we're seeing who are victims of homelessness also victims of domestic violence?
That is a great point, and I think it's a wonderful opportunity for the media to continue to participate in these conversations. I think today is a great showcase of talent and innovative thinking. And I think there's a responsibility of media to also show the variety of individuals who are impacted by homelessness. And it doesn't need to be, disclosing confidential information about someone who's a survivor of domestic violence, but an image of families. We see that in New York City. We see that it's single adults as well as families that are hurting and are displaced and need support.
Jennifer, thank you so much for your comments. Please stick around for the final round. And we move to Desiree Des Martinez, who survived intimate partner violence. She was unhoused for 5 years. Desiree, welcome.
Hi, thank you so much. I wanted to say hello to everyone and thank you for inviting me in your space. I became homeless due to interpersonal violence, experiencing mental and emotional abuse that led to a mental breakdown. Lacking insurance, I sought help at a local mental health office, but ended up being confined as they deemed me a risk. I was desperate for assistance and a safe haven, but never received any. The treatment in the mental facility needs scrutiny, as my experience left me unwilling to endure the relentless suffering. I reached out to national hotlines, which directed me to local resources, yet the limited ability of support in my county left me pleading for help. Despite not meeting the criteria for a homeless bed at a domestic violence shelter, I found myself at the local homeless shelter, sleeping on the floor amongst various individuals. The gender restrictions they had at that time left me exposed to the streets once again with no option for a safe shelter. Financial constraints hindered my ability to relocate. Surviving on a fixed disability income while facing steep rent prices kept me from finding a permanent home of my own. I chose homelessness over returning to abuse. I spent my time on the streets using my photography skills to document the realities and advocate for a change. Engaging in local government meetings and community gatherings, I aim to shed light on the challenges faced by the unhoused. Through involvement with organizations like UCSF, BHHI, I found a platform to share my experiences and advocate for those similar situations. Today, doors of opportunity have opened for me to speak up and be heard, thanks to the support and education provided by UCSF, BHHI. I am determined to empower others and to raise awareness about advocating for themselves and their communities. Currently, I've been able to be permanently housed temporarily on a housing voucher for affordable housing. I'm nervous that every year, because the rent continues to increase, but my voucher price does not. And soon I will not be able to use my housing voucher in the home I am in, because affordable housing is not really affordable. But I have hope that changes are being made and more will come as long as the solidarity continues with our unhoused brothers and sisters. Today, I'm a national advocate for universal housing, civil rights for the homeless, outreach and crisis intervention worker for encampments, established a homeless union by currently unhoused individuals, created a social media platform to showcase the perspective of the unhoused, and the operation of a nonprofit dedicated to supporting the homeless community. I would like to conclude this with one very important understanding. The media has a crucial role in molding our society and impacting our perceptions. It would be beneficial if the media helped raise awareness and incorporated the viewpoint of the unhoused in all homeless-related narratives. Thank you, and I guess I'll take questions.
Thank you, Des. We have some very good questions in the chat here for you. Can you tell us what helped you the most in your toughest time? That's one question. And then there's a follow-up.
My son.
Your son?
Yeah. The being a mother, having a child, that's what made me not give up.
Was your son able to go to shelters with you?
No, my son was of age. He was over the age of 18 when I experienced homelessness.
Okay, all right. The follow-up question is, did you fear being stalked by your ex-partner?
Being unhoused, you flee an abusive relationship because you want safety. Anything far away from that is safer than what you think. Being unhoused puts you in a situation to be abused by many strangers. And unfortunately, I ended up going back because I'd rather be abused by one than thousands of different strangers every day. So
You
it's
went
very
back.
fearful, yeah,
Yeah,
until I got tired and went out again.
yeah, yeah. Was there anything that changed when you went back? And this for me, I just think it bears amplifying. Did your partner change in any way when you came back?
For about 48 hours.
Okay. And then things went back to the way they were.
Yes.
Yeah, absolutely. Could you talk a little bit more about the dangers on the street?
Oh, yes. For women, it's so dangerous for women to even become unhoused and have to survive the streets. You have a lot of sex trafficking out there. You have a lot of drugs. A lot of people talk about drug addiction and mental illness causes homelessness, but people need to understand that homelessness will cause mental issues and addiction, regardless if it's alcohol or drugs. You get afraid. You got to stay up all night in order not to be raped. You're cold during the winter, so you utilize drugs. If you don't want to utilize drugs, you're usually forced to, because in my county, we have a lot of sex trafficking, very high sex trafficking. So the dangers of being unhoused for a woman, she'll be on her moon, which some people call period. You have nowhere to change, no shower, no nothing. You don't feel like a female. You're scared constantly all the time. You're preyed on every day. It doesn't matter what time of day you are preyed on. Usually we try to find big encampments that we can stay at, because the bigger the encampment, the more people there are, the more witnesses there are when something happens to me. You never want to stay alone. That's the worst, just to have to sleep somewhere in a little corner or a doorway by yourself. A lot of people choose to go back home because it's cold out there. You're hungry, you're starving, you're being abused. You've tried the system, and the system made you want to just give up on life, period. And you still want to live. So your only option is to go back if you want shelter, unfortunately. But the fear out there, it raises the trauma. So much more trauma as I endured being unhoused. After going through the trauma, I was trying to escape. It didn't make any sense to me why I couldn't get shelter.
And did you find allies on the street? Were there people that you banded with?
Oh, yes. Oh, yes. That's why I call them my street family members. If it was not for them to show me how to survive, I probably would have turned to drugs and alcohol. So they are my street family members. That's what we call each other here in my city.
Yeah.
But yes, oh yes, there's a lot of people out there that you just meet, and it's amazing. It's beautiful. I tell people the best meal I've had was sitting at a cookout, a food serving giveaway. And I'm going to tell you that nothing matters, your race, your color, your creed, your sexual orientation, because at the end of the day, we're all sitting at the table and we're eating out of the same bowl.
Wow.
Every single one of us. I've sat with people that were raised to be racist or discriminatory, and we would sit there and we would cuddle in the same sheet under the same tarp. you know, with the sitting on the same cardboard, eating out of a cup, both of us. You meet a lot of amazing, talented individuals out there that have just been lost and forgotten. And those are the individuals that I advocate for, because I want the world to know that just because we're unhoused, that does not mean we're bad. We need to change that. And people need to know there's individuals, thousands like me, that just wanted shelter so I didn't have to endure more trauma.
Pilar Marrero has a question for you, Des. Pilar?
Okay, I was unmuted. Hi, Des.
Pilar
Thank you.
is EMS's associate editor. I'm sorry, I didn't introduce you
It's okay.
correctly. Yeah.
It's fine. Hi, Des. Thank you for your testimony. It really makes my heart sink to hear these things. But I'm glad to see that you've moved on and that you're doing good work. I just wanted to follow up on what Sunita asked you when she said, you know, what helped you move forward. Of course, you said your son, but I'm thinking, you know, what kinds of resources, external resources, help you to move on with your life? What are the things that women in your situation need the most? If you can share with us, so we can learn better.
What I ended up receiving was a housing choice voucher that allows me to pay 30% of my income. That's what initially helped get me off of the streets. Was if it wasn't for that housing voucher, I would still probably be out there, and who knows what I would have ended up doing. I believe that if I would have been able to seek shelter, and if this shelter would have had emergency housing vouchers set aside for individuals like myself, I believe that it would have prevented me from going through the trauma that I received while being unhoused. It still stays with me today. It still affects me in different ways. But if we did have emergency housing vouchers set aside specifically for interpersonal violence and domestic violence, then I believe we would have less trauma. We would have more short-term care for individuals instead of long-term, you know, having to have endure so much more trauma out there. The best thing to do is having a housing choice voucher. Having a housing choice voucher at 30% of their income would be something that the individuals would need in order to protect themselves and be able to rise, and give them counseling services, offer them counseling services that they can come to at no charge. Maybe some Zoom meetings if they can't come out of the house yet. These are things that I would have loved to have. I would have loved to have a mentor, somebody who's been through what I've been through, a peer support, somebody I can just call at 2 o'clock in the morning because I'm afraid, you know? These are things that I wish I had that support, but I didn't have that support. I felt like I was a problem to people. I felt like I was just their job. Some shelters treat you like a number on a filing system. And for the domestic violence shelters to not recognize or act that I'm just another check. I just wish I had more and I didn't have to suffer.
Seema Gupta has a question. It may be more of a comment, but Seema, do you want to ask your question of Des? Seema, are you still with us? Seema said, I'll just read out her comment. Seema says, it's the system, it's not the community. Hope the system gets the message and acts, which is a reasonable comment, I think. So what amount of a lump sum or monthly stipend would have helped you to get housed again, Des?
It was a one-time lump sum, I think $5,000 getting me in, being on disability. If I was receiving a housing voucher, let's say, given a $5,000 lump sum to pay for deposit, 3 times the rent, the application fee, the moving costs for the van, and maybe some basic essentials that I need in order to get started. So approximately it's $5,000 and a housing voucher, I think would have been great for me. Now, if it's not a housing voucher, then you're looking more into a couple months rent, everything, double deposit, first and last month's rent, monthly rent subsidies for maybe up to 6 months to get you back on your feet. So you can go through your counseling services, you can go through your therapy, you have your peer supporter, get back into the community. And after 6 months, then maybe you have had a job. So having, yeah, just those things. I'm sorry, I can go on and on.
No, that's fine. That's fine. And so our final question is for all speakers. What have you learned from, as you interview Dr. Hargrave, Jennifer, as you interact every day, and Des with your, time when you are amongst unhoused people? What have you learned from unhoused people who were victimized by domestic violence? Dr. Hargrave, let's start with you.
Thank you. And this has been such a lively and important discussion. I've been trying to also respond to people's comments in the chat. And I do want to echo the importance of media, of messaging around homelessness and around domestic violence and intimate partner violence, that these issues are extremely important, and advocacy around them is essential. So speaking from the BHHI study, it really identifies systemic failures in protecting the safety of an extremely vulnerable population of people experiencing intimate partner violence, and that the dual impact of intimate partner violence and limited financial resources places survivors at increased risk of experiencing homelessness. As we've talked about today, due to shortages of affordable housing and the rising cost of living, many low-income survivors are forced to choose between enduring violence at home or risking homelessness. And a national strategy to address the connection between intimate partner violence and homelessness is crucial, and it must include strategies for increasing permanent housing options for survivors. So I hope that you all take that away from our discussion today, and feel free to reach out to me at any time if you'd like additional comments.
Thank you. And what would your headline be if you were writing the story? Yes.
Oh, my headline. I'm so sorry. We were talking about this, Des and I, right before coming through the meeting today. And I think the main headline really is that you can't address intimate partner violence and homelessness without addressing the need for permanent affordable housing.
Thank you. Jennifer, if you could answer the question and also give us your headline for this briefing.
Yes, I too want to thank you for this opportunity today. And I want to thank Des for sharing her story. I think to be vulnerable and to share such private details is so empowering and so helpful to the community, so that people understand the experience. I'm grateful to our client Hope, who shared her story and has gone with us to special events to talk about her story. So I think for me, the number one thing that I've learned from doing this work for so many years is that listen to the survivors, listen to their voices. They matter. I've seen government and even nonprofit providers sit in a room and think through strategies without investing the time and effort to reach into community to ask, how can we do this better? And I think as an organization, we have learned that investing in the voices, creating equity is so important to ending cycles of violence and consequently ending homelessness. I also wanted to stress that we talked a lot about data today, but just to remind everyone that domestic violence is often underreported. And so again, today's opportunity to be able to raise awareness, to offer education for those that might be on that are, experiencing it or know people that are experiencing it, can now share. And again, I will echo what was said earlier about the media and the media's responsibility to share these stories, to tell these stories, to push for solutions, community-based solutions, and ultimately, I think investments in increasing education, awareness campaigns, investments in economic stability, whether it's micro grants or housing subsidies, and then affordable permanent housing, which in New York City and in California are, incredibly expensive. And so, but those are the key solutions. And I appreciate hearing my colleagues in California talk about the work, and there's so much overlap. There's so much synergy between New York and California.
And you did give us a great headline. Listen to the survivors. Yeah, terrific. Thank you so much. And Des, last word to you.
Yes. What was the question? The specific question?
Yeah, what have you learned from being out on the street with other unhoused people? What did you learn before you were out on the street?
I learned that I'm stronger than I
Mhm.
thought. I learned that I can speak up even when my voice cracked. I learned that I was not the only one that was going through what I was going through. I learned how to be more compassionate. I learned that there was a lot of resources that we have that lack the continuous funding we need. I did learn that there was a lot more hate when you become unhoused from housed individuals. So far, I would say I would see a friend and they would put their head down and walk past me.
Wow.
The same friend that I knew for 5 years and shared food with at school and stuff like that, I learned that I can heal. I learned oh my gosh, there's so much that I learned. There's so much negative and positive that I learned. But what I learned is I'm not alone. I learned that I can stand up and fight. And I learned that I'm never going to stop speaking out because even though it takes 9 years to make one change, it still made a huge impact on other people's lives. And I want to continuously teach others out there that want to learn that there's a space in the union for them to be able to speak up too, because a lot of people want to speak up. They're afraid and they just need their hand held on 1 or 2 steps. And then after that, you let go and they're on their own. So there are people out there that want to speak up. But as long as they have these important meetings right here and you start inviting people like me with lived experience to your meetings, it teaches us and it makes us more powerful and more strength. So I learned that speaking about my story has helped me come through some of the storm. And being able to speak my story has made me stronger to make more changes in the world. And I just want to kind of walk away with people who have experienced homelessness often feel invisible, but it's important for them to use their voices and share their experiences. We need to educate people about what's really happening in the streets and that we're good people who just want a permanent home. And thank you for letting me share my story.
It's wonderful. Thank you to all our. Thank you so much. Thank you to all our.
My title.
Oh, yes, of course.
So we were talking about this earlier, and we're going to use it though, but hostile home, the rise of domestic violence, and the fall of housing in the 21st century.
Perfect. Great headline. Thank you to everyone for joining us today. This was a very robust and informative discussion, and we'll see you all next Friday.